Good afternoon. My name's Whitney Isaac. I'm the MLA for Calgary Glenmore. I just want to start off today with a land acknowledgement that we are here on Treaty 7 territory, the traditional lands of the Blackfoot Nations, the Kainai, Piikani, and Siksika, along with Tsuut'ina First Nation and the Stoney Nakoda First Nation, as well as the Region 3 Métis. So welcome to Calgary Glenmore, and welcome to the Rockyview Hospital that you see behind me here. This is an important landmark for our constituency and for many Calgarians. And like many people in my community, 3 generations of my family have received care from this hospital. My children were also born here, and I'm very pleased to be here for this announcement today. And with no further ado, I'd like to introduce the Honourable Jason Kenney, Premier of Alberta.
Well, thank you very much, Whitney, and thanks to everybody from the Rockyview for welcoming us here to this great vista. I will get to the subject of today's announcement in a moment, but before doing so, I wanted to address a couple of other pressing issues. First of all, I'm very happy to report that yesterday, in a 3-0 decision, the Federal Court of Appeal ruled in Alberta's favor on a critical decision protecting our Canada's Economic Prosperity Act, which some have called the Turn Off the Taps legislation. This is legislation that was brought in a little over 2 years ago to allow Alberta to control exports of our natural resources, and it gave us an additional tool in our toolkit to respond to other jurisdictions that might seek to landlock our resources. I'm happy that since that legislation was brought in, first of all, our government, in its very first act, within hours of being sworn in, proclaimed that into law. It was subsequently challenged by the BC government, and yesterday's 3-0 decision by the Federal Court of Appeal removed an earlier injunction. So it's a very important tool to allow us to protect the value of our resources, and we're delighted with the outcome of that. On another matter, as you know, on Sunday, the regional municipality of Wood Buffalo declared a state of local emergency, and local First Nations in northeast Alberta have also expressed concerns about the high level of COVID-19 spread in the region. And our government has been working closely with local leadership. I know that Minister Shandro and Dr. Hinshaw met with Mayor Don Scott yesterday by phone, and earlier today with First Nations leaders. I've been in touch as well with local leadership. And as I've mentioned before, we have seen a significant number of vaccine doses going unused, and that's why the decision has been made to extend vaccine hours to 10 p.m. In Fort McMurray, and to continue to work with the community to make sure that there is high uptake with those life-saving vaccines. But in addition, Dr. Hinshaw has recommended, and Minister Shandro and I have accepted the following recommendations. First of all, we're scheduled to begin receiving the Johnson & Johnson Janssen vaccine as of next Monday at the beginning of May. And so we will direct all doses of that vaccine received in the next 2 weeks, as supply permits, to the 2 highest incident areas in the pandemic, which are currently the rural municipality of Wood Buffalo and Banff, in order to help accelerate vaccine coverage in those areas. We'll develop strategies with the leadership of those communities to address vaccine hesitancy and encourage greater vaccine uptake, and also make it more convenient, as I've mentioned, as we've already done in Fort McMurray. And we will be setting an eligibility age of 30 years of age and older in these areas for the AstraZeneca and Janssen vaccines. So, as you know, currently the minimum age province-wide is 40. That's based on the scientific advice of the National Advisory Committee on Immunization. But Dr. Hinshaw, in consultation with experts, has decided that accelerating the vaccination program in those communities, which also happen to have younger populations, would be helpful in addressing the outbreaks. And finally, we'll be lowering the eligibility age for the Moderna vaccine in adjacent First Nations and Métis communities within that zone to 30 years of age. So that's a significant reduction. Of course, we have been from the very beginning providing earlier age access to the Pfizer and Moderna vaccines to Indigenous Albertans, First Nations and Métis people because they've had more challenging health outcomes, and this decision that we've accepted from Dr. Hinshaw further reflects that. So with that, thank you for joining us today, and I'm here outside the Rockyview Hospital in Calgary to speak about Alberta's historic commitment to healthcare in this great province. I'm joined by colleagues Whitney Isaac, as you've heard from, Health Minister Tyler Shandro, Infrastructure Minister Prasad Panda, and I also want to recognize Dr. Ted Braun, Vice President Medical Director for Central and Southern Alberta at Alberta Health Services, and Dr. Kelly D'Souza, Clinical Director of the Rockyview Hospital. I also especially look forward to hearing from Mike Meldrum, President and CEO of the Calgary Health Foundation, who will speak about that foundation's partnership in our announcement, and a heartfelt thanks to Krista DeVoe, a young woman from the Calgary area who will be sharing her journey of living with Crohn's disease and needing access to special health services in our province. Such stories of hope and resilience help us all to recognize and to better understand the amazing public health care that Alberta offers to all of its people. In Budget 2021, Alberta's government made an historic investment, the highest ever spending in healthcare by far in Alberta history, to protect the lives and livelihoods of Albertans. This includes a $23 billion investment this year in healthcare, as I say, the largest single investment in history. Plus, in addition to that, an extra $1.25 billion in contingency funding to support the battle against COVID-19. Our plan to protect lives and livelihoods also provides a 3-year, $2.2 billion commitment to health infrastructure projects. This funding supports our ongoing work on projects dear to the hearts of so many Albertans, including the new Grand Prairie Regional Hospital and the Calgary Cancer Centre. It also commits $143 million for 5 new projects, including the remediation of the old High Prairie Health Complex to make space for new development for the health system there. We're also building a new maternity and community health center to serve the needs of the growing northern community of Lacrete. And 3 exciting projects moving forward here in Calgary. We're expanding the neonatal intensive care unit here in Calgary at the Foothills Hospital, and we're building a new cyclotron and radiopharmaceutical manufacturing facility also in Calgary, the first of its kind in southern Alberta. And finally, the reason that we are here today, we're providing $59 million over the next 3 years to upgrade and expand the Rockyview Hospital's intensive care unit, the coronary care unit, and the gastrointestinal clinic. Each year, these units care for many more critically ill patients than the spaces that they were built for years ago. And that's why we're expanding them, to ensure that people and families living in Calgary and the surrounding areas will have better access to top quality intensive care, coronary care for heart problems, and diagnosis and treatment for a host of gastrointestinal issues. Minister Shandro will provide details on these investments in a moment, but we know that as our population ages, more people will need improved access to screening programs for things like colon and lung cancer, and so many Albertans already struggle with Crohn's disease, with inflammatory bowel disease and irritable bowel syndrome, and need access to non-surgical procedures, services, and care. So thanks to a generous contribution from Calgary's Health Foundation, this project will double the size of the Rockyview's gastrointestinal clinic. Regular Albertans stepped forward, dug into their own pockets, and are now partnering with Alberta's government on priority projects like this one at Rockyview that will improve their health and their access to medical services. All told, expanding the ICU, the coronary care unit, and the gastrointestinal clinic at the Rockyview means that thousands more people from southern Alberta will have access to the care that they need when they need it and where they need it. More hospital beds, more access to complex health services, more space for patients, doctors and nurses, more suites for non-surgical procedures. This project is part of Alberta's ongoing commitment to improve public health care and to build a health system around the needs of patients and families. Projects like these will also spur much needed growth and will help our economic recovery as we emerge from the COVID-19 pandemic, putting people to work, expanding these facilities. We are investing not just in the health of our residents, but in the health of our broader economy. Investing now in priority capital projects like this one at the Rockyview Hospital and many others across the province is investing in a sustainable health system that will serve Albertans well into the future. So thank you very much, and with that I look forward to more details from Ministers Shandro and Panda, and then to hear from our other guests here today.
Well, thank you, Premier. And thank you to Whitney for welcoming us to Calgary Glenmore. I think Acadia is just across the street there, but it is great to be back at the Rockyview. Like Whitney, both of my kids were born here as well, so it's great to be back here. A quick mention as well that today is April 28th, and therefore the National Day of Mourning as we remember workers who were killed or sickened or hurt after work-related incidents, and in particular Zolt Varga, who is an advanced care paramedic who is a passionate advocate not just of patients but of his fellow paramedics. And thank you, Premier, for joining us today. It's great to hear from you directly about government's commitment to support and to continue to build a world-class health system that's centered on the needs of patients and their families. I'm delighted that this work here at the Rockyview is a part of that work. And each year the ICU admits about 275 patients into the 10 beds, providing specialized care for the sickest patients. The coronary care unit, or the CCU, with its 7 beds, is also incredibly busy, caring for close to 540 patients each year who need critical care after a heart attack or after a surgery. Together, the 2 units, for a quarter of the time, care for patients more than their nominal capacity, and they manage occupancy as high as 130%. Now, to be clear, ICUs and other units do sometimes go over 100% at their peak times, and that's not new, but this is too much. It's a problem that needs to be fixed, and we are fixing it. This project will expand the ICU and the CCU to 25 beds, all in single patient rooms, up from the current number of 17. So from 17 to 25 of these beds. And it will move the units into a combined and updated unit that will be a better space for patients and a better space for the staff who work in them. We're also very pleased to partner with, as Premier said, the Calgary Health Foundation to expand the gastrointestinal clinic. And this is urgently needed since Alberta has a very high rate of Crohn's disease as well as rates of inflammatory bowel disease and irritable bowel syndrome. The clinic's 4 endoscopy suites consistently run at 90% of capacity, providing colonoscopies and other procedures to detect changes or abnormalities in the digestive system in a patient. Now, the GI clinic is near capacity right now, and they expect to see another 36% increase by the time we get to 2030. So they need more space, and that's why we're doubling the size of the clinic, including 2 more endoscopy suites to allow them to do 4,000 more procedures each year. And the new space will make it easier to meet the current standards for infection prevention, infection prevention and control, as well as isolation. And it will support the unit's role in teaching and training staff and physicians. and it will give patients and families more space and more privacy during visits and consultations with their care team. So thank you to everyone at the Rockyview. Thank you to the physicians, to the staff, to the volunteers, to the managers who work so hard to give Calgarians the very best care anywhere. And thanks to all of the generous Albertans who have supported the hospital through the Calgary Health Foundation. I'd like to now welcome Minister Ponda to the podium to talk about this project and its impacts on the economy here in Calgary.
Thank you, Minister Shandro, and good afternoon, everyone. It's my pleasure to join you today in the riding of Calgary Glenmore, and I want to acknowledge my good friend MLA Whitney Isaac for being such a strong advocate for projects like this in Calgary area. And it's my pleasure to discuss about the impact that the Rockyview General Hospital project will have on our Calgary community. Budget 2021 allocated $59 million over the next 3 years for this project behind us. And I would like to acknowledge the Calgary Health Foundation for their generous $10 million contribution. And this project is expected to support over 410 good paying construction and construction related jobs throughout the duration of this project. The project will develop 34,000 square feet of shell space that was previously built in 2010, allowing for future expansion when required. And that time is now. Design activity will get underway this summer, and construction will start in 2022 and will be completed in 2024. Throughout the pandemic, our government has focused on protecting Albertans' lives and livelihoods. When planning budget 2021, we knew we had to invest building and maintaining public infrastructure to address the future needs of Albertans and to get Albertans working. And if you observed the last 14 months in Alberta, construction never stopped. So Premier wanted us to make sure that the livelihoods continue. And that's why Budget 2021 is focused on protecting Albertans' lives and livelihoods. We know the importance of keeping Albertans working so they can support their families and their communities can thrive. The Rockyview General Hospital project will not only address an identified health need here in Calgary, it will also help support good paying jobs, generating investment in our communities, and is an integral part of Alberta's recovery plan. As you remember, Alberta's recovery plan invested $10 billion last year in vital infrastructure projects, and this year we approved $20.7 billion to be invested in infrastructure during the next 3 years. A good portion of the wages paid to workers are spent in local businesses and services, helping friends and neighbors by keeping people working and supporting the local economy. Through Budget 2021, we are building the health and public infrastructure that Albertans will need as we emerge from the grip of the pandemic. And as we take our position as an economic leader in Canada. As the Minister of Infrastructure, I can assure you that I will closely monitor the development of this project because Premier, every time I see him, he keeps asking if all these projects are on time, on budget. So I'll be a pain in the neck for Minister Shandro to allocate his resources and partner with Alberta Infrastructure to get these projects built on time, on budget. I look forward to the day when we all will gather here again to celebrate the opening of this new facility. I would also like to thank Hayden for picking up this beautiful location today. And now I would like to ask Dr. Kelly D'Souza from Alberta Health Services to come to the podium. Oh, sorry.
Thank you, Premier Kenney, Minister Panda, and Minister Shandro. Good afternoon, everyone. My name is Ted Braun. I'm the Vice President and Medical Director of Clinical Operations with Alberta Health Services, and I'm very pleased to be here together with Dr. Kelly D'Souza, the Medical Director for the Rockyview, to represent Dr. Verna Yu, our President and CEO, our entire executive, as well as our board. In celebrating this very significant impact this investment will have on the thousands of patients and families who receive care here at the Rockyview every year. This upgrade is to one of the city's busiest adult acute care sites, is an important step in decreasing wait times, improving patient outcomes, and increasing capacity. We're very grateful to the Government of Alberta and the Calgary Health Foundation for their support in making these improvements possible. Relocating and expanding the Rockyview's GI clinic will enable the hospital to add a new procedure room, as Minister Shandro mentioned, and double the space and capacity. This will ease capacity pressures and allow for more flexibility in caring for patients with complex needs. Once expanded, the GI clinic, we anticipate providing more than 14,500 procedures every year, a significant increase over our current capacity. We will also improve wait times to meet targets established by the Canadian Gastroenterology Society for urgent priority endoscopies, reducing the current 4-week window to just 2 weeks. The demand for diagnosis and treatment for digestive disorders has climbed steadily over the years. With the realization of this new clinic, we are very excited to play a pivotal role in meeting that demand through expanded and enhanced care. Expanded and enhanced care also describes what patients and families can expect through the dramatically redesigned and integrated ICU and coronary care unit, or CCU, here at the Rockyview. It's been about 26 years since the last significant upgrade was made to the Rockyview's ICU. Not surprisingly, the dozens of staff and physicians who provide care to the almost 1,100 patients admitted to the ICU and CCU each year are very excited about their future home and what it means for patient care. This investment will increase ICU capacity from 10 to 14 beds and CCU capacity from 7 to 10 beds. Not only are we adding more beds, we're also creating a better, safer experience with larger patient care rooms to support critical life-saving equipment. A good example of this is the integration of bariatric support equipment. This will allow us to better meet the needs of bariatric patients while supporting the health and wellness of care providers. All patient care rooms will also have individual washrooms and windows. Exposure to natural daylight is well documented in the scientific literature to be instrumental in mitigating and managing delirium or confusion in patients. With a large part of the ICU's quality improvement work focused on minimizing delirium in critically ill patients, this is a meaningful step we will take in enhancing patient care. Additional aspects of the new unit include a dedicated family space with sleeping area, kitchenette, washrooms with showers, more quiet rooms for loved ones to visit with patients, and an outdoor patio for patients and families to enjoy fresh air. This is a really important feature for long-stay ICU patients in particular. A joint ICU and CCU will result in significant efficiencies through an integrated staffing model that will support shared resources and the ability to respond quickly to changing needs. We also expect the unit to attract top talent, as it will offer a unique opportunity for healthcare professionals to work in a diverse clinical environment with both cardiology and critical care. In closing, I would like to once again thank you, our government and foundation partners, for making these significant improvements at the Rockyview General Hospital. I would also like to take this opportunity to extend my gratitude to the dedicated physicians, staff, and volunteers at AHS who continue to rise to the unprecedented challenge our province continues to face. Indeed, we're in the midst of Wave 3 of the pandemic. This wave is having a major impact on the tens of thousands of Albertans who we rely on every day to provide quality and timely care. But I want to assure you we are prepared. Despite working tirelessly for more than a year, our incredibly dedicated staff and physicians continue to rise to the challenge. I know I speak on behalf of Dr. Yu and all of AHS executive leadership when I say we're very proud of their tremendous resilience and unwavering compassion. Be safe, be kind, and please get vaccinated as soon as you are eligible. I would like now to turn the podium over to Mike Meldrum, the President and CEO of the Calgary Health Foundation. Thanks very much.
Good afternoon, everyone. Thank you for the introduction, Dr. Braun, and also Premier Kenney, Minister Shandro, and Minister Panda for your commitment to advancing care here at the Rockyview General Hospital and across the Calgary zone. We're excited to partner with you in these big investments that will impact people across southern Alberta. Sooner or later, and often unexpectedly, we all depend on the healthcare system. And when we do, we want to ensure the best possible outcomes. Today's announcement represents two different aspects of care. One, to enhance diagnostics and treatments that will return quality of life to people living with chronic disease, or provide earlier detection and intervention for those facing a life-altering diagnosis. The other, to ensure life-saving intervention is at its best when people need it at their critical moments. Our mission is rejecting the status quo, and Calgary Health Foundation supporters are motivated to ensure that the best possible care is available for our loved ones. Through this collaborative investment with the Government of Alberta, our community will have the most preeminent life-sustaining interventions, diagnostics, and treatments when we need them most. Gastrointestinal conditions do not discriminate by age or gender. In fact, many Albertans are at risk and will likely need the care of a GI team at some point in their life. This has led to increasing demand for these services in a space that can no longer accommodate the innovations and best practices available in today's standards of care. That's why Calgary Health Foundation is pleased to commit $12 million to a state-of-the-art space that will offer the highest level of care for GI patients here at the Rockyview General Hospital and throughout their journey with the health system. Today, you're going to hear from Krista DeVoe, who, due to a chronic condition, relies on our health system and services offered by the GI Clinic. This investment by the Calgary Health Foundation is in support of people like Krista, who face chronic conditions or will get a diagnosis that will disrupt their lives. Through improved access to these services, it is our collective goal to help patients manage their disease more effectively and improve their overall wellness. I would now like to introduce you to Krista DeVoe for her to share her story.
Good afternoon. My name is Krista. I've been a GI patient here in Calgary for the last 8 years. I was diagnosed with an inflammatory bowel disease called Crohn's in my home province of Nova Scotia when I was only 9 years old. Since then, I have relied on expert GI services to help manage my condition. I know firsthand the importance of having access to specialized services, especially when living with a chronic bowel disease. I grew up in a small rural community where I had limited resources available to me to help my illness as it progressed and as my needs became more complex. But since moving to Calgary in 2013, my level of care has improved greatly because of having readily available GI services at my fingertips. This expansion is a step in the right direction because quicker access to these services means an improved quality of life for so many like me. Over the last 20 years, expert GI services have helped me find the best treatment options, get regular testing, and follow-ups before and after surgery to get a proper diagnosis, and it has played a huge role in my overall care plan. Thanks to these services, my overall quality of life has improved so much in the last couple of years. As someone living with a chronic bowel disease, this expansion at Rockyview General Hospital will be an important step in enhancing care for thousands of Albertans who suffer from these diseases and who rely on quick access to GI services to get proper diagnosis, treatments, and care. I'm hopeful that this announcement will allow patients like me to have less worries about when or if we'll receive care, so we can focus more on our future and living our lives as normally as possible. Thank you.
Now I'm going to turn over to the phones for questions. We'll have time for 2 questions each today, either 2 off the top or 1 question and 1 follow-up. With that, operator, can you please put through our first caller?
First is James Keller with the Globe and Mail. Go ahead, James. James, your line is open. Please go ahead.
The caller and try to circle back with James.
Okay, sorry, James. We're going to move on to our next caller now. Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon. Premier, with all due respect, I have a question that is not about the announcement, even though the announcement I know is very, very important and significant. There have been reports over the weeks by several media outlets of some people within your party who are upset with your leadership. I think you went on the Roy Green show a couple of days ago and addressed a question on that issue. What do you see as the underlying reasons for this upset, and how do you see this sort of shaking out in the future? How do you see this as becoming resolved as time goes on?
Thanks, Rick. I have to say I'm really not here to talk about politics today, but it's no secret that a minority of Albertans are very upset with public health restrictions that we've had to put in place to save lives and to protect our healthcare system. I understand that frustration. As I've said before, I'm glad to live in a province where there's a lot of people who jealously guard their freedom and are understandably skeptical about government using extraordinary powers. At the same time, I would say to those folks, whether they are in my political party or elsewhere, that this government has tried as best it can to follow the data, the best public health advice, to take a balanced approach with the goals of avoiding preventable deaths, avoiding an overwhelming of our healthcare system, while also trying to minimize the impact of restrictions on the broader health of our society. Maintaining that balance has not been easy. We have done our best, and what I would also say to folks who are upset about the public health restrictions is, once again, if you have a loved one who's waiting for surgery, they may have to wait for months longer because of postponements due to the surge in COVID cases. If you may have a loved one who could become hospitalized from this disease and its more lethal and contagious variants. So this is about all of us and coming together as a community. And I really don't think that we should allow politics to divide us as we seek to find a way forward together in what's left of this pandemic. And finally, I would say to people who are frustrated, we are at the 10-yard line. The end is very much in sight, thanks to the vaccines. We've now vaccinated about 30, first dose vaccines have gone to about 38% of adults in Alberta, about a third of our total population. Another 10% have some degree of natural immunity from prior infection. So the numbers are going in the right direction, but we've got to get over the hump of this current wave and then be able to enjoy a good Alberta summer.
Rick, do you have a quick follow-up?
Yes, a quick follow-up is, Premier, again, with all due respect, I wasn't really asking a question about COVID. I was asking a question about discontent by some members of your party with your leadership. Now, that might be connected to COVID. Part of it almost surely is. So I wonder if you could just address the issue of there are people who are discontented. They're in your own party. Some of them are even in your own caucus. Some of it is COVID. How do you see all that? How do you deal with that situation?
Well, Rick, you asked me why I thought some people are upset, and I gave you the answer, which is I think primarily there are some freedom-loving Albertans who are very frustrated with the public health restrictions that the government has brought in. I lead the government, and I'm ultimately responsible for those. And so the frustration and anger gets focused on me in this position, understandably so. But you know, I think when we look back over the past year, we could learn lessons, and we would have done some things a bit differently. But overall, to people wherever they reside in the political spectrum, who are angry with public health restrictions and focus that anger on this government, on my performance as Premier, I have this to say. What's the alternative? Was the alternative to let the virus run completely loose, to make no reasonable efforts to control viral spread? The critics are not responsible for what happens in our healthcare system. They're not responsible for avoiding an overwhelming of our hospitals. The government is, and the government takes that responsibility very seriously and will continue to do so.
Operator, can you please put through our next caller?
Yes, we're going to try James Keller again. Go ahead, James.
Hi, thanks for indulging my technical problems here. Yesterday, this is a question for the Premier. Yesterday, the leadership of 11 First Nations and Métis communities called for significant public health measures in the Fort Mac area. A curfew, a stay-at-home order, restrictions on non-essential businesses. Is your government considering any of that?
We are actively considering additional targeted measures, particularly in some of the hardest hit areas of the province, including Fort McMurray, Wood Buffalo. And so I know that Minister Shandro spoke with some of those First Nations leaders earlier today. Indigenous Relations Minister Rick Wilson has been in constant contact with First Nations leadership throughout the pandemic. I just announced this afternoon, that we are going to be providing additional vaccine doses and eligibility at the lower age of 30. We've already, from the very beginning, recognized the particular vulnerability of Indigenous and Métis people to this disease, which is why we have had given that population about a 15-year head start in terms of the age eligibility for the COVID-19 vaccines, and we're expanding that even further now. So I understand and hear their concerns, and as I say, we are actively considering additional targeted measures, particularly in the most hard-hit areas.
James, do you have a follow-up?
Yes. So when asked about vaccines earlier this week, you singled out vaccine hesitancy among Indigenous people. Is there any evidence that this is a significant source of the current outbreak? I mean, there aren't any outbreaks right now on any of the reserves in the area. Vaccine rates are higher among Indigenous people than the general population. So can you just tell me a bit about what was behind those comments?
Well, I think you're somewhat mischaracterizing my comments. Let me quote them for you precisely, verbatim. This was from Monday. I said that We've provided a lot of extra support for that region of Wood Buffalo. For example, we provided tens of thousands of rapid test kits to some of the oil sands work camps and to help them in detection. Then I said the population up there is disproportionately Indigenous, and as you know, we've had a much lower age eligibility for vaccination for First Nations population. We've done a lot of extra outreach efforts working with the First Nations to address vaccine hesitancy and make it as convenient as possible in a culturally sensitive way to deliver those vaccines. I did not claim that local reserves or First Nations communities are seeing particular outbreaks, but we were responding to concerns being raised by First Nations that you've just reiterated, and they're right to be concerned about the situation in that part of the province. The point I was making, which I'll restate, is that given the health sensitivity of Indigenous communities to COVID-19, we have provided easier and broader access to vaccines. We've sought to do so in a culturally sensitive way. And when it comes to vaccine hesitancy, that was actually an issue first raised by First Nations chiefs, including Chief Alan Adam and other Treaty 8 chiefs. I'll point you back to a article in CBC that I believe was in February, indicating that a clinic set up in Fort Chipewyan for vaccination had about half of the expected uptake, and the local Indigenous leadership was making a special call for people and on the government to help to address certain misconceptions about the safety of the vaccines. So that's an issue that's been raised by First Nations leadership. We've tried to work with them collaboratively to educate folks about the safety of the vaccines, to make them available in a culturally sensitive way, locally and conveniently. And today we're taking another step forward in doing so.
Operator, can you please put through our next caller?
Yes, our next question is from Rishi Nagar with Red FM. Go ahead, Rishi.
Thank you. Can I request Mr. Panda to respond to my question, please?
You can go ahead and state it, and he'll be up here in a moment.
Sure, sir. In the time of economic crisis in Alberta, we do need investment in infrastructure. And what are the various other projects that your Ministry of Infrastructure is investing in, Minister?
Thank you, Rishi, for that very timely and sensible question. I'm happy to share with all the investments. Government of Alberta is busy in investing last 2 years. Our government our focus while saving lives is also at the same time protecting the livelihoods. Like the project here you heard today, we are spending millions on Rockyview, millions on Foothills cyclotron and Foothills power plant, cogen plant, and also neonatal at Foothills. And you all know $1.4 billion in Calgary cancer. And then in Calgary, again, there is a long-term care center near Bridgeland. And at Peter Lougheed, we are investing hundreds of millions. So, and also in capital maintenance and renewal across the province, we have been investing to fix the affordable housing, mitigating flood in Calgary, and there are so many projects. And also in justice infrastructure, we are building a Court of Appeal new building in Calgary, and also in Red Deer. There is lots happening, and also yesterday you would have followed the start of construction at Vivo in the north part of Calgary. So there is lots happening. It's all part of Alberta recovery plan. We're trying to get people back to work. So this $20.7 billion investment in the next 3 years will create almost 90,000 jobs. Thanks for the opportunity to share all that investment in public infrastructure. Thank you.
And Rishi, do you have a follow-up?
Yes, please. Mr. Panda, India is passing through a critical period in the phase of COVID-19 crisis. The government of Canada has assured to release $10 million towards Red Cross India. Mr. Panda, you are also active on social media towards providing help to the Indians in distress. Is your government doing also something to help them out?
Thank you. First of all, Premier and all of us here, we want to send our sympathies to the families that lost their loved ones in India. They're going through a lot of challenges. I also want to thank Government of Canada for stepping up to help India. My understanding is they do have oxygen, but they don't have the infrastructure to get it to the places where it is required. And I have been in contact with the High Commissioner and the Consular General and also the high-ranking officials in Foreign Ministry, and some elected officials got in touch with me. So we'll look at opportunities. I'll discuss with Premier and Minister of Health to see how Alberta can collaborate in removing their difficulties. But I saw also some news yesterday or this morning. Government of India actually is procuring 100,000 portable oxygen concentrators, and also additionally more than 1,000 PSWs, which are oxygen generators, with actually local technology. Their Defense Research Development Organization developed indigenous technology so they can produce oxygen near where it is required. So that's why every day, I feel we are so lucky in Alberta with all the investment we are doing in health and vital infrastructure here. And I'll actually encourage India to look at that long-term investments in infrastructure. But it's very critical for all of us to stand with India now, because if we help India breathe, and if they come out of this pandemic soon, they'll help all of the world with vaccines and other generic drugs, and because they're the world leaders. But I wish them all the best. Thank you.
We have time for 2 more questions. Operator, can you please put through our next caller?
Next question is from Adam Toy with Global News. Go ahead, Adam.
Yeah, hi, this is a question for the Premier or the Health Minister. We have learned that there are no more AstraZeneca doses available for pharmacies and no more appointments with AHS for those AZ shots. What's your message to the tens of thousands of eligible Albertans who are hoping to get an AstraZeneca vaccination but won't be able to?
Thank you. And first, we are going to continue to have the Pfizer vaccine coming, and it's a secure supply that's coming, 119,000, and some every week. It's going to be increasing by 100,000. Moderna, hopefully, those shipments no longer see those disruptions, and Janssen and the Johnson & Johnson one as well. Now, starting next week, as Premier said, is going to be coming into to Alberta. So the AstraZeneca, we're hoping to continue to procure more in the coming months. There are some opportunities we have in being able to obtain AstraZeneca through the federal government. Just a reminder, though, to everybody that Alberta can't buy vaccines. Vaccines are not procured or not developed here locally in Canada. We have to procure it from other countries. We the approval process through the federal government allows them to confirm that they have the exclusivity in purchasing all those doses. So we are waiting for the federal government to continue to procure further AstraZeneca. For the rural pharmacies, of course, we want to continue to make sure that they have a continued supply. As people are making their appointments, they're making appointments for vaccines that haven't yet arrived here in Alberta. And so as people make their appointments, when they're eligible in the 4 groups in phase 2, A, B, C, and D, then when they make those appointments, we then ship, as the vaccines arrive in Alberta, we ship those vaccines where those appointments have been made throughout the province, through our community partners like the pharmacies or AHS sites as well. So we'll continue to make sure that those supplies are there for pharmacies and AHS throughout the province. Oh, sure.
Sorry, I just wanted to add a point or two, which is that, first of all, 10 days ago, we had a problem of AstraZeneca supplies piling up and people not using them. So we had about 170,000 doses in fridges across the province Sunday of last week, about 10 days back. And that's when we decided to open up the age categories to 40 and above. And I just want to say that while this is a problem and we share the frustration of people who are now queued up and can't get that AZ vaccine, that at least we got those shots into the arms of people. They're no longer sitting on shelves, and that's a good thing. One of the reasons for the supply shortage there actually relates to Mr. Nagar's earlier question about what's happening in India. India is supposed to be our major supplier of AstraZeneca, but because of the crisis there, they have banned, at least temporarily, vaccine exports to deal with their own population. It's regrettable but understandable. It's another sign of vaccine nationalism and another reason why we've got to develop be able to produce our own vaccines here at home in the future.
Adam, do you have a quick follow-up?
Yeah, just wondering if you expect this to impact the race between vaccination and this third wave, and if you can speak to how that will impact it.
Well, yes, because every delay in supply is a loss in that race, unfortunately. And the big problem is this, that we didn't have adequate supply in the first 3 months of this year. Unlike the US, Israel, UK, and so many other countries, we were slow off the start getting our hands on vaccines in Canada, and that gave the variants time to spread, and that's how we ended up in this third wave. But I do have some, I think, good news just to amplify what Minister Chandra was saying, is that we are expecting, to be precise, some large shipments in the next couple of weeks. As he said, starting on Monday with Johnson & Johnson's Janssen vaccine, we are expecting fairly large shipments. We now have, as of last night, 59,000 doses of AstraZeneca in current inventory. Of course, many of those are already out in pharmacies and waiting to be put in people's arms. And here's the problem. We have 76,000 doses booked to be administered in the next 7 days. So you're right, demand is now outstripping supply in that respect. And we are expecting next week to receive 236,000 Pfizer doses, and the week following, another 236,000 Pfizers, plus 117,000 Modernas and the Johnson & Johnson. So I actually think that in the month of May, we may be able to inoculate with the first dose upwards of 700,000 people, and that'll be a game changer for sure.
Operator, can you please put through our last caller?
Final question is from Francois Joly with CBC. Go ahead, Francois.
Bonjour. Question in English and French, if I may, for Premier Kenney. AHS has a protocol for triage for if we get in a situation where demand exceeds capacity for COVID cares in Alberta hospitals. How close is the province to implement that kind of protocol?
You want that in English and French, Francois?
Yes.
Okay. Yeah. So my understanding is that AHS has protocols for triage generally, but they're doing work on updating that based on advice and input from their advisory group. And I expect that they'll be publishing a revised triage protocol specifically with respect to intensive care in the fairly near future. Many provinces did this last year, and it's only prudent to prepare for that. To be clear, right now, we have capacity to deal with this surge. We cannot take that for granted, but we are able to, we've worked very hard through AHS by giving them all the resources they need to expand ICU capacity to deal with a kind of worst case scenario in the pandemic. and we believe that they can accommodate up to 425 functional staffed ICU beds for COVID patients should it be necessary. But we obviously don't want to push the limits on that, and that's why we renew our call on Albertans. Please, please follow the public health measures and restrictions that are in place so we are not put in anything like that kind of a position. En français, I'll just say the same thing in French. Le gouvernement de l'Alberta et le service de santé de l'Alberta a toujours certaines balises pour le triage de soins médicaux et il y a une démarche actuelle à les services de santé de l'Alberta pour faire une précision des critères pour le triage de soins intensifs dans le contexte évidemment de COVID-19. Plusieurs autres provinces ont fait exactement la même chose l'année dernière et je crois que le service de santé ici sera prêt de publier les critères prochainement. Mais il faut dire que nous avons la capacité actuellement, avec l'élargissement de capacité, nous pouvons accommoder environ 425 personnes avec le COVID-19 dans les lits de soins intensifs. Mais c'est essentiel que les Albertains suivent les mesures de santé publique pour que nous puissions, pour que nous évitions cet scénario-là.
François, do you have a follow-up?
Yes. Oui, encore une fois en français et en anglais. You've said that you knew for a long time, for 3 weeks, that we would get to that 20,000 active cases that had been foreseen for a long time. Are you, where are you willing to go? Are you willing to go down the road of a place where Alberta needs a triage system for intensive care before implementing further restrictions?
No. Well, first of all, let me just say this about further restrictions. The notion that there's a direct linear relationship between the restrictions and viral spread is not the experience of this pandemic. Properly targeted restrictions that people actually comply with can be a useful tool in limiting viral spread. But indiscriminate restrictions that people ignore broadly are not an effective tool. And there are so many different examples and counterexamples around the world. You know, Peru had, in the first wave of COVID, by far the strongest and longest lasting lockdown in the world, and they also had one of the worst rates of infection and fatality. Right now, our measures are broadly similar, in most respects almost identical to those of British Columbia. Their numbers are going down in BC, but they're going up in Alberta. Look at Toronto, where they've been in pretty much a hard lockdown since December, and they've had a real problem, of course, with high numbers putting big pressure on their healthcare system. So I try to convey that there's I think a false idea out there that we can just that quote unquote lockdowns stop viral spread and that they can be effective in every instance. That's not the case. But I will say that we are actively considering additional targeted measures, particularly in areas that are being hardest hit. And let me be absolutely clear, this government will not allow our healthcare system to be overwhelmed. The number one thing that we focus on every day is the capacity, particularly of our intensive care units. And while there is pressure now, and that pressure will grow over the next 2 to 3 weeks based on the current number of active cases, we as Albertans need to pull together to make sure that we do not put too much pressure on the healthcare system and those working on the front lines in urgent care. I'll say the same thing in French, briefly, pour dire qu'il n'y a pas nécessairement un lien exact entre les mesures, les restrictions de santé publique et le contrôle des virus. Nous pouvons voir plusieurs exemples des juridictions avec les restrictions très dures qui ont eu les vagues de virus très sérieux. Et autres juridictions, comme la Colombie-Britannique actuellement, avec les mesures pareilles à celles de l'Alberta, où les chiffres diminuent. Alors, l'essentiel est que le grand public suive les mesures et les restrictions. Et ça, c'est notre focus. Mais cela étant dit, nous considérons actuellement les mesures supplémentaires ciblées, particulièrement dans les régions plus affectées. Et ce gouvernement ne permettra pas le système de santé, particulièrement les sections de soins intensifs, d'être débordées en ce qui concerne la demande. Thank you very much.
That concludes our time today. Thanks, everyone.